Meaningful Use Stage 3 aims to increase patient engagement and improve patient outcomes. How? By requiring hospitals and health professionals to use certified electronic health record, or EHR systems. One focus area for this technology is to provide healthcare consumers flexibility in how they access their personal health information safely and securely. With Stage 3, patients will have the opportunity to connect to their EHRs using an application of their choosing that is supported by an Application Programming Interface, or API. Just think of an API as the wiring to an outlet in a house. If the house is properly wired, electricity will flow and power on an appliance when one is plugged in. Similarly, hospitals and providers are wiring their electronic health records with APIs, so they will be ready to enable the flow of personal health information when consumers use a new app. Let's take a look at a patient's journey after health systems have implemented API technology. Meet Kate, a 57-year-old spouse and parent living with type 2 diabetes and neuropathy. She was recently hospitalized due to complications with her diabetes and prescribed new medications. Upon discharge, Kate follows up with her neurologist, whose office is in a separate health system. He makes some additional adjustments to her current medications. As her medication requirements have grown more complex, Kate wants an easier way to keep track of all of them. After hearing about an app that helps organize and remind her to take her medications, she decides to download it to her mobile phone to help better manage her care. Kate creates an account and authorizes the app to connect to the different EHR systems at the hospital and her physician's office. Luckily for Kate, both venues now have the proper technological framework to support the use of patient-centered apps, thanks to Meaningful Use Stage 3. Both systems have already worked with their IT vendor to configure their health systems to allow seamless data transmission to the mobile app. Kate now has access to her medical record from both venues and can use the app to pull in all of her medication information so that she can keep track of them in one convenient location moving forward. Kate is now engaged more than ever in her own health thanks to open platforms that provide her with options to access her personal health information from different electronic health records. At Cerner, we offer solutions and services to help you navigate the ever-changing health industry. We're like your regulatory easy button to help you focus on what's most important, keeping the patient at the center of care.
Alrighty, so this is Drew Torres, Senior Solution Strategist at Cerner, working on our Open Platforms unit. This webinar is about patient access through APIs and what Meaningful Use Stage 3 has to offer in enabling consumer access through APIs. So to talk about what's changing for Meaningful Use Stage 3, this is a blurb from CMS talking about what the intention is around the regulatory requirements for the APIs. The idea is that in order for a patient to have access to their health information electronically, which is now a civil right, the idea is that the API should enable an application or enable the patient to be able to select an application of their choosing to connect to the EHR so they can retrieve their health information and take it wherever they may go. So to compare previous versions of the Meaningful Use and regulatory versions, we could see here with Meaningful Use Stage 2, the idea was that we enabled the view, download, and transmit requirements, and that was primarily done through a portal. For this example, we have a Cerner system with a Cerner patient portal, and the patient accessing their health information through that portal. With Meaningful Use Stage 3, that is now not the situation. In Meaningful Use Stage 3 and consumer access strategies, the idea is that a patient should be able to go through to a consumer market, Google Play Store, Apple App Store, Microsoft's app ecosystems, and be able to download any application that's configured to the API and be able to retrieve their health information how they see fit and take it wherever they may go across the continuum of care. So you can see here we have a picture of a consumer in the lower right corner downloading an app from the App Store, accessing and logging in through their credentialing system, their identity provider, and we'll talk a little more about the different systems and parts for accessing the API and the identity provider. But you can see once they're credentialed, they can access either through portal or an application of their choosing to retrieve data from the EHR, in this example being Cerner Millennium. So this is the app ecosystem, or the consumer ecosystem, that Cerner wants to create for our consumers and enabling patient access. So you can see here the consumers have the ability to discover applications that are configured to the API, whether that be the Apple App Store, the Google Play Store, or the Windows Microsoft ecosystem. There's a consumer centralized app store model, you can say, that enables them to discover and download applications. So in the upper left corner, you can see developers will have the ability to collaborate in Cerner's open developer experience, be able to connect to the APIs, and then be able, once they've developed their application ready for go to market or what have you, they'll be able to publish to those different app ecosystems. You can notice the developers have the ability to become validated applications, but that is not required for consumer app ecosystems. But that is an option if they want it to be elevated in the developer program and become, premium members of our ecosystem. So this is the relationship between the app developer, the API, and the identity provider. So a patient needs to be able to be credentialed to access their health information. That's the way health systems have the ability to adjudicate whether or not this patient has the right to access data. This is generally done through some kind of invitation process that's handled either in registration or in the office or during their encounter with the healthcare provider. So you can see here there's a trust relationship between the identity provider and the service provider. The service provider in this case is the APIs, and in this example those will be FHIR-based APIs accessing the EHR. The app developer, the consumer, will then request an authorization or authentication to the identity provider, and that's what will enable access to the APIs once that authentication has been validated and confirmed. So you can think of this as your standard, for those that are technical in the audience, your standard OAuth 2 workflows where you log in and then redirect it back to the application to be able to view data. So to talk about the identity verification versus identity management, so the key here, there's two parts to this. The invitation itself, how a patient actually gets access to their health information. That's really key, and that's the first step. And this is less of a technology problem and more of a process problem. So a patient, when they go to the health systems, will receive an invitation, generally done by an email or some sort of manual process, but the identity of the patient must be verified. And this is something that must remain in order to ensure that our health systems are abiding by any sort of regulatory requirements that they may have around the release of health information. And then the second part of that is really the identity management system. So this will be your identity providers. So this is more of the technological pieces that enable the patient to actually access their health information. So you could think of this as kind of your Facebook profile login, your Google login. In the cases of healthcare, that'll be generally will be your patient portal credentialing system. So the idea is that you'll be able to leverage your existing credentials you use to access your health information to be able to access your data through these applications. So to talk at a high level of the process for those that are trying to develop applications or for those that want to access their applications, there's kind of a workflow that has to be stepped through in order to gain access or to be able to connect to the API. The idea is that the health system has the API enabled to be able to connect different applications. When a patient requests an application, the idea is that any apps that have been connected, a health system can maintain a list of applications that have already connected, kind of make it easier for the patients to be able to view the list and pick and choose without having to manually discover. This will be good to streamline the process when they want to be able to select different applications. Kind of makes discovery a little bit easier. The second scenario is the patient selects a different application that may not be in that list of applications. So there's 3 different scenarios that application can fall into. It's the app and client are currently connected, and in that situation, the patient should be able to use their existing credentials to be able to access the application. The application is connected for the vendor, so for this example, the application is connected at healthcare facility A with Cerner, but not at healthcare facility B. So in that case, the app developer may have to do additional work to onboard or whitelist that particular endpoint. And then once that application becomes connected for healthcare facility B, the patients will be able to use their existing credentials to access the data. And then there's this third situation where the application has never connected to the API or may have connected to a different vendor. So there is additional work for the application developer to do there. So the idea here is that the clients, when the application is not connected, the client reaches out to the application developer, informs them of API documentation. So for Cerner's example will be code.cerner.com. That is where all of our public-facing documentation will be available. Other vendors will have other websites for their public-facing documentation, which is required under regulatory requirements. Then the application developer, if they are interested in developing an application, will then go through their standard development process, developing either in Sandbox, developing a proof of concept, testing that application, going through a beta launch, and then potentially launching to production. Once they launch to production or feel that they're ready for general availability, they can then connect to the production instance of the API. And then once that's done and available for that particular healthcare organization, the client ensures that the patient has access to the APIs, that being an invitation is sent to the identity provider, making sure the patient can access through portal and be able to access through the API. And then the second scenario is where the developer is not interested in developing an application or not interested in connecting to the API. This is really the only situation where it's okay to tell a patient that the technical capabilities of the application do not meet our requirements and you will not be able to use this application for accessing your health information. Now, there are other options or avenues in which the patient can get their data at that point. They can download their CCD from the patient portal if they want to try to integrate it into that application. But that largely depends on the capabilities of the application. When the app developer is not interested, that is really the only place it's okay to say no to the patient. So to kind of summarize what we've discussed here, it's the key takeaways: patient identity verification and patient identity management are separate processes. One is a workflow policy problem, whereas the second is a technology problem, integrating one identity provider into the API to enable seamless login and credentialing for applications that want to integrate to the API. Understand the difference of the different types of applications. There is a difference between an application that is not integrated or connected to the APIs. An application that is not connected to the API may have the technical capabilities and just need to be onboarded, whereas an application that has never integrated to the API will need to do additional work in becoming available for patients to download and view their health information. Clients could maintain a list of applications that are connected to make discovery for different types of applications easier on the patient population. Clients must allow any application that is willing to connect to the API, they must allow them to connect. Under no circumstance is it okay to reject an application that is willing to connect to the API. And the only scenario where it's okay to reject a request is when the application developer is not interested in connecting to the API. Clients will need to understand the process to connect applications and be able to articulate that to patients, so that way the patients will be able to discover, download, and view their health information through the API. So I wanted to show briefly here an example application that is configured to the API. You can see here, this was an application developed by one of our app developers in the ecosystem in conjunction with one of our clients. The idea is that the patient was able to download the application. It is a medications management application. It allows the downloading of their meds list and be able to view reminders as to when they need to take their medications. So you can see here that it starts with a quick login screen, says start now or log in. There's a welcome page that says here's the application, and then you can see on this final screen here where it allows for the ability to manually add medications for those that are not documented in the EMR, or the ability to import your medications from the EMR. So you can see here the example on the left-hand side. This is really a proof of concept application. You can see that this application is connected to multiple sandboxes: Cerner sandbox, Epic's sandbox, Allscripts, and Athena sandboxes. And then it's also connected to two healthcare organizations, one being Trinity Health and Hackensack Meridian Health. You can see then we log into the Cerner sandbox. We are then asked and prompted for our credentials. And then you can see on the third page, I know this may be a little small, but the patient then authorizes the application to be able to connect to the EHR to be able to download their medications. Once you click authorize, and you could also have a copy of this authorization emailed to you for record keeping, you will then be redirected back, and the EMR is connected to the application. And then you can see the list of medications that are currently maintained in the EHR is now viewable and downloaded into the application and available for review, and be able to populate a virtual pillbox for reminders and notifications to take the medications. This concludes the webinar on patient access through APIs. For additional information about Cerner Sandbox, you can visit code.cerner.com. We have a Google group and a collaboration space that allows developers to proactively develop applications. And we do offer the ability for patient credentialing integration testing in that sandbox, which is available for anyone and everyone to use at no cost. So please visit code.cerner.com. Thank you.